Interesting story here, and Kenya remains on high alert over the resurgence of deadly diseases in the region, with the Ministry of Health now advocating for heightened surveillance across all border posts in efforts to reduce infections in the country. Now, additionally, one person has lost his life and 5 others hospitalized following a cholera outbreak in Migori. Elizabeth Atieno now tells us more.
This was the situation at the Jomo Kenyatta International Airport in Nairobi. As the aeroplanes touch down, passengers present their travel documents and are screened through the Port's Health Services Department, and their status displayed on this screen mounted at different points at the airport. Then they sanitize their hands before proceeding to the next stop. We noticed that each point at the airport has a Port's Health Services unit, this being a clear indication that indeed there is a cloud of fear over the outbreak of Ebola, Marbug and Mpox virus in the neighboring countries, and so the Ministry of Health says it is on high alert to prevent the spread of these diseases in the country.
And given our proximity and frequent cross-border movement, Kenya remains at high risk of importation, requiring urgent and coordinated action to mitigate the spread of these 2 diseases.
This week alone, Kenya has reported 3 cases of Mpox, rising the total number to 41. So far, over 3 million travelers coming into the country have been screened, with 419 suspected cases taken for further analysis.
WHO has been supporting the Ministry of Health in training border health management officers in developing and updating emergency preparedness and response plans, including all the components.
Ebola, Marbug and Mpox are not the only existing threats to Kenya's public health sector. One person has tragically lost his life and 5 others have been hospitalized following a cholera outbreak in Migori County.
At the same time, we have banned sale of food in the open in that region. We have also banned eating in the funerals in that village. At the same time, we are doing a lot of sensitization.
This new warning signals looming suffering for millions of poor Kenyans who seek critical healthcare services at public hospitals, as nurses in 5 counties have already downed their tools, citing among others poor working conditions.
Tumekusanyika hapa wauguzi ili tuwe kuweza kutetea haki yetu ya kikatiba, kwa sababu iko very clear kwa katiba, work of equal value must attract equal remuneration.
Clinical officers, on the other hand, are set to begin their strike on Monday. Elizabeth Atieno, TV 47.